It's 11 at night, and your dog is hunched over the toilet bowl, lapping like he hasn't had water in days. You laugh, half asleep, and close the lid. 3 days earlier, on your evening walk, he'd done the same thing at the edge of a puddle by the park, the kind with a faint greenish shimmer on top that you told yourself was just pollen. Now he's laying on the kitchen floor, breathing a little fast, not touching his dinner. You start to wonder if the two are connected. Here's the uncomfortable truth. The water your dog drinks when you're not paying close attention might be doing more damage than anything in his food bowl, and the thing you assume is harmless, just water, can sometimes be the most dangerous thing he swallows all week. Hi everyone, I'm Dr. Ryan Scott, your neighborhood veterinarian. I see this exact scenario play out in my exam room more often than you'd think, because most owners assume that if it's wet and their dog wants it, it's basically fine, and that one assumption ends up costing families thousands of dollars and a lot of sleepless nights. In this video, we're going to walk through exactly why standing water can turn from harmless puddle to genuine medical emergency. I'll teach you a real way to size up a water source in about 5 seconds flat. We'll talk about the well-meaning habit that actually makes things worse when your dog does drink something questionable, and then I'll give you a tiered set of prevention and response steps, plus my personal favorite field trick, before we land on the specific red flags that mean you stop everything and get to a vet immediately. If any of this is new to you, it means there's probably a friend with a water-obsessed dog who needs this too, so go ahead and subscribe now so you don't miss the rest of this series. Let's start with the biology, because this is where most of the fear either gets justified or gets calmed down, and I want you to actually understand it rather than just be scared of it. There are two separate threats hiding in still or slow-moving water, and they work completely differently, so it helps to think of them as two different villains wearing the same disguise. The first is cyanobacteria, commonly called blue-green algae. Even though it's technically not a plant at all, it's a photosynthetic bacterium. When water sits still in warm weather, especially water rich in nutrients from fertilizer runoff or waterfowl droppings, these organisms multiply explosively, forming what's called a bloom. Think of a bloom like a bacterial greenhouse. Warmth, sunlight, and nutrients, all trapped together in still water, create the perfect growth chamber, and the population can double within hours under the right conditions. Some strains of cyanobacteria produce toxins as a byproduct of their normal metabolism, and depending on the species, those toxins are either neurotoxins that interfere with nerve signaling, causing tremors, paralysis, and difficulty breathing, or hepatotoxins that damage liver cells directly. There's no antidote for most of these toxins, which is exactly why prevention matters so much here. The second villain is Leptospira, a corkscrew-shaped bacterium that infected wildlife, most commonly rodents, raccoons, and deer, shed in their urine. When that urine contaminates a puddle, pond edge, or even a flooded yard, the bacteria can survive in the water for weeks, particularly in mild, damp conditions. Leptospira doesn't need to be swallowed in large volumes to cause a problem. It's able to penetrate directly through mucous membranes, and even through tiny breaks in the skin, which is why a dog can pick it up just from wading and then licking his paws afterward. Once inside the body, the bacteria travel through the bloodstream and settle preferentially in the kidneys and liver, where they cause inflammation and, in more severe cases, organ failure. This is a real, documented, and honestly under-recognized cause of acute kidney disease in dogs, and it's part of why many vets recommend the Leptospirosis vaccine for dogs with regular outdoor exposure. Something worth discussing with your own vet based on where you live. Now let's move to Chapter 2, the home assessment. You don't need a lab to make a smart call about a water source. You just need your eyes and about 5 seconds of attention before you let the leash go slack. A cyanobacteria bloom often looks like someone spilled a thin layer of green, blue-green, or even reddish-brown paint across the surface of the water. And it can also look like clumped scum or streaks that gather along the downwind edge of a pond. Genuinely algae-heavy water sometimes has a distinct musty or grassy odor, though I want to be honest with you here, plenty of dangerous blooms have very little smell at all, so odor is a helpful clue, never a guarantee. Here's a myth I want to correct directly. A lot of owners believe that moving water, like a stream or a drainage ditch after rain, is automatically safer than a still pond. It's true that fast-moving water is less hospitable to algae blooms specifically, but Leptospira doesn't care whether the water is moving. It just needs to have been recently contaminated by infected urine. and a fresh puddle from last night's rain can be just as risky as a stagnant pond that's been sitting for a week. Clear and moving is not the same thing as clean. This brings us to Chapter 3, and this is the part I really want you to sit with, because it's the most common mistake I see, and it comes from a genuinely loving place. Many owners assume their dog has some kind of built-in instinct to avoid bad water, the same way we assume a dog won't eat something truly rotten. Unfortunately, that instinct doesn't reliably apply here. A dog's nose is extraordinary at detecting scent molecules, but cyanotoxins and Leptospira bacteria don't have a smell that triggers avoidance behavior. And a hot, thirsty dog after a long walk or a game of fetch is running almost entirely on urgency, not caution. Thirst drive overrides discernment. The second mistake, and this one genuinely worries me, is what some owners do after the fact, once they suspect their dog drank something bad. I've had clients tell me they gave their dog table salt at home to try to induce vomiting, sometimes based on advice they found online. Please don't do this. Salt draws water across cell membranes through osmosis, and in a dog, especially a smaller one, even a modest amount of concentrated salt can cause dangerously high blood sodium, called hypernatremia, which can lead to swelling in the brain, tremors, and seizures. You'd essentially be trading one emergency for a second, separate emergency, and inducing vomiting safely at home is something that should only be done under a veterinarian's specific guidance and with the correct product, never with salt. So what's the safe alternative? Let's move to Chapter 4. The real fix here isn't a home remedy at all. It's prevention through management and a very simple redirection technique. Before you let your dog approach any standing water on a walk, take 3 seconds to actually look at it, using the visual checks we just covered. If it looks even slightly questionable, you use what trainers call a turn-and-walk redirection, rather than yanking the leash, which can spike your dog's excitement and make the water seem even more interesting. You calmly change your own direction and start walking the opposite way while saying a cheerful, upbeat cue like, "Let's go." Dogs are highly responsive to their handler's body language and energy, so a confident change in your walking direction, paired with praise the moment your dog follows you, teaches him over time that turning away from murky water gets rewarded with your attention. This works because you're not fighting the thirst drive directly. You're substituting a more rewarding behavior before he ever gets close enough to drink. Now for Chapter 5, the tiered approach, because prevention works best in layers rather than as a single rule you're trying to remember in the moment. The first and most foundational tier is carrying your own water. A simple collapsible bowl and a bottle of water from home means your dog never has a reason to seek out a puddle in the first place, especially on hot days when thirst is highest. Offer water every 15 to 20 minutes during exercise, rather than waiting until your dog seems desperate. The second tier is teaching a rock-solid leave-it cue, well before you ever need it near water. Practiced first with low-value items like a piece of kibble on the floor, then gradually built up to higher distraction settings like a park path, using small, high-value treats as the reward for disengaging. The third tier applies if your dog does manage to lap up a small amount of questionable water and shows absolutely no symptoms afterward. In that case, rinse his mouth gently with clean water from your bottle. Monitor him closely for the next 24 to 48 hours for any change in energy, appetite, or bathroom habits, and hold off on anything that could upset his stomach further, like rich table scraps, for that same window. I want to be honest that this monitoring step is about early detection, not a cure. It doesn't undo any exposure that may have happened. It simply helps you catch a problem early, if one develops. The fourth tier, for any dog showing even mild symptoms after a known exposure, drooling, a bit of lethargy, a slightly reduced appetite, is not a home remedy at all. It's a same-day call to your vet, because Leptospira and cyanotoxin exposure can escalate quickly, and blood work is the only way to actually know what's happening internally. Here's Chapter 6, my favorite trick, and it's one I genuinely use myself with my own dog. I call it the 2-finger test, and it takes literally 2 seconds. Before letting your dog drink from any unfamiliar outdoor water source, dip 2 fingers in, then rub them together. Clean water feels like, well, water. It evaporates cleanly off your skin. Water with a heavy bacterial or algal load often leaves behind a faint slick, almost soapy or filmy residue on your fingertips, because organic material and bacterial biofilms change the surface texture of the water. It's not a laboratory-grade test, and it won't catch every risk, especially Leptospira, which can be invisible to touch and sight both. But paired with the visual scan we talked about earlier, it adds one more layer of real information in under 5 seconds, and I promise once you start doing it, it becomes second nature on every walk. Now, Chapter 7, and this is the part of the video that matters most, so please don't skip it. Home monitoring and prevention are genuinely useful, but there are specific signs that mean you stop everything, put the water bottle away, and get your dog to a veterinarian immediately. No waiting, no watching overnight to see if it passes. These signs include repeated vomiting or diarrhea, especially if it continues past 1 or 2 episodes, noticeable muscle tremors or full body shaking, wobbliness or difficulty standing that wasn't there before, excessive drooling that seems sudden and out of character, labored or rapid breathing at rest, gums that look pale, blue-tinged, or yellowish rather than their normal pink, a sudden and dramatic increase in thirst or urination, or, conversely, a drop in urination altogether, and any seizure activity, which is always an immediate emergency regardless of the cause. The reason these signs demand professional care rather than home treatment is that a vet has tools you simply don't have access to at home. Blood work that can detect early kidney or liver stress before it becomes visible on the outside, IV fluids to support organ function while the body clears a toxin, and in confirmed leptospirosis cases, specific antibiotics that need to be started early to be most effective. Yellowing of the gums or eyes in particular points toward liver involvement, and that's not something any home remedy, however well-intentioned, can safely manage. So let's bring this together, understanding why still water turns dangerous, learning to actually look at a water source instead of assuming it's fine, replacing the let him figure it out instinct with a calm redirection habit, and knowing the specific red flags that mean it's time for professional care. That's not paranoia. That's just what responsible, attentive dog ownership looks like in practice. And if you ever find yourself standing over your dog at midnight, trying to decide whether this is a wait-and-see situation or an emergency, choosing to call your vet or an emergency clinic isn't you overreacting. It's you doing exactly what a good pet parent should do. I'd love to hear from you in the comments. Has your dog ever gone straight for a puddle or a pond on a walk before you could stop him? And did you notice anything, a smell, a strange color, a weird film on the surface, that made you hesitate? I read every single comment, so tell me what happened and what you did next. It genuinely helps other worried owners reading through these comments later. If this video helped you feel a little more prepared next time you're out on a walk, hit like and subscribe so it reaches other pet owners who might be standing at the edge of a puddle right now without realizing what's actually in it. I'm Dr. Ryan Scott. Stay safe, and I'll see you in the next one.